Welcome to Ask Dr. Mark. We are back from vacation. We are back from an enforced vacation. You know, you guys must know by now, I never take vacation. But I was forced to have a vacation because everyone else was on vacation, so I worked. But yes, he's a doctor, Treb. I'm a doctor. And I may not necessarily talk like one, but I have the knowledge base of one, so that's probably a good combination. Look, you can see my stethoscope here. Here we go. Put it on the webcam. Anyway, last time we had a guest host, Dr. Kim, who may come back on again. Thank you, a smart doc. Thanks, Jake. But everybody just said they liked her voice better and the way she looked younger, and I kind of agree with that. But you know, we'll have to get what we we'll take what we can get. I'm going to bring on some guest hosts from time to time on the show. I think I have a hand surgeon lined up for either this next week or the week after, an orthopedist. I want to get somebody here. I'll lower my camera tad. Yes, I want somebody else to take sports medicine and orthopedic questions, because we get asked a lot. I'm Dr. Marc Siegel. I'm an internist and an associate professor of medicine at the NYU School of Medicine, where I'm also a fellow in the Master's Scholar Society. I'm a senior fellow at the Center for Medicine in the Public Interest. I'm the author of False Alarm, the truth about the epidemic of fear, based on the idea that we're afraid of the wrong things and that fear is contagious in the United States, especially in the post-9/11 world, and not just in the United States, everywhere in the world. I wrote Bird Flu, everything you need to know about the next pandemic. Main thing you need to know, it ain't coming anytime over the next few months or years probably. I wrote a novel, Bellevue. I write a column for the Los Angeles Times called The Unreal World, where I look at TV, movies for medical accuracy. I have a lot of fun with that. The one I did this past week was called The Bucket List, which has just come out. It's actually in limited release in New York and LA, and it'll be out around the country within a few days from now. It's an excellent movie, very, very, very interesting, and you can check it out you can check my take on it out at latimes.com in the health section, although a few critics have pointed out that I give away the ending, so you may not want to read my column until you've seen the movie. So every Monday night on Paltalk at 6 p.m. we come here and we answer your medical questions. But I don't answer them specifically because I can't be your doctor. So I answer general medical questions as they may or may not apply to you. And I answer your friends' medical questions. I like to answer public health questions as well, and political questions as well. And I try to get a little humor in this, because medicine, though very interesting, especially when it comes from the horse's mouth, also gets a little dry. So we have some questions lined up this week. My favorite fan and friend, Anna Karenina, is not here. I heard a rumor she has been banned somehow. I hope that's not true. Anyway, Al Aobai. Al, you're on with Dr. Mark, Al. Anna's there. Al, I can't hear you. Where'd you go, Al? John here, you're on. John here, Jane here, John here. You're on the mic.
Happy New Year to you, I wanted to say. I have a real quick question. I don't know if this has an answer or not, or if it's one of those medical mysteries. Recently, a family member, the baby, she was 7 months pregnant, and the baby died in the body. And she's not the first one that I've heard this happen to, and I've heard of other women this happening to. And they naturally induced her, and she delivered the baby, although he was stillborn. Are there reasons for this to happen in the womb for a baby to die like that, or is it kind of like part of SIDS that nobody really has an answer?
What a sad and important topic. The first answer is probably a reassuring one, that nature has a way of taking care of itself, and probably the most likely reason for a baby to die at third trimester of pregnancy is because there's a genetic or other problem that would not have made them do well in their early years of life. That's the same thing that's true with the SIDS deaths. You know, they tend to come in high-risk situations. SIDS really just means that we don't know why. You know, the same. It's sudden death, and sudden death in latter terms of pregnancy sometimes is genetic. Sometimes it's because it's a high-risk pregnancy to begin with, but it's not a good prognostic sign, meaning that the baby may not have done well, the fetus may not have done well in any case. Genetic is the leading cause. There are other issues, and I mean, I can use that to launch onto a very important topic here without saying it's directly connected, which is if you are pregnant, you know, the healthier lifestyle you have, light exercise, sleeping well, low stress, no cigarette smoking, no alcohol, no drugs, no medications if possible. Sometimes the medications are better than the condition you're running away from, so sometimes medications are necessary, like with asthma, sometimes with depression. But the healthier you can live when you're pregnant, the better it is for your fetus, which is not to say that a stillbirth or a loss of a baby in third trimester is automatically or even close to automatically being the mother's fault. I'm not implying that at all. I'm just using it as a launch point to describe a different topic. But a lot of times we don't know what happened to that third trimester kid, to that third trimester fetus, but genetics is often a possibility. Charlie 55, you're on the mic.
Hi, Dr. Mark. I want to ask some question about, as a doctor, I don't know if you find out, recently they cut the legs and hands of 5 Iranians in Iran, and there were 5 doctors as well cutting the hands and the legs. As a doctor, are they not swear to help the human being, not to cut them in pieces? Thank you. Send you the link, you can watch on the...
Well, I'm not sure what your question is exactly. Are you asking whether doctors should participate in terrorist acts, or doctors should use their skills in other ways than for humane purposes? Of course, my answer to that is, you know, I'm not even a big believer in doctors being used for executions, and I'm not actually a big believer in physician-assisted suicide either, but let me explain that. I think doctors' roles are to prolong life or ease suffering. Sometimes easing suffering means taking a life or causing the acceleration of death, but not specifically you come to your doctor's office and say, you know, now's the time. I think doctors have to watch what their roles are really closely, and I definitely don't think they should be slashing wrists or cutting wrists. They should, you know, we were trained to hopefully be therapeutic and caring. We saw, you know, I have to bring up this horrific reminder. Remember what doctors did under the Nazis. Jolie, you're on the mic with Dr. Mark.